Assalamu alaikum everyone. Today we are going to try remembering the adverse effects of antibiotics a bit easier. Just to mention, the adverse effects were taken from Dr. Romany's slides. So you really need to study Dr. Romany's lectures first and then see this video or see the link to this data show. So let's start with cell wall, inhibition of the cell wall synthesis, and let's begin with penicillins. Let's remember this story. So this is the mom and this is the son. The mom was holding a glass of Vimto. And what color is Vimto? Red. And what else is red? Well, blood is also red. So this is going to remind us with hematologic toxicity. Keep that in mind. So her son came up to her and told her that he really wants to go to the bathroom so bad. And this reminds us with nephritis and diarrhea. Okay, so her son was moving so much that he had punched his mom, and the Vimto that she was holding was actually all over the place. So she got so angry that her face turned so red. And what else is red? Rashes are red. Okay, so keep hypersensitivity in mind as well. And what else? Okay, now we are going to talk about them in deep. So first, Vimto causes hematologic toxicity. And what is that? That means that we have degrees of coagulation, especially with antizoonomal penicillins, okay? And other hematologic toxicity is eosinophilia, okay? And we said that he wants to go to the bathroom. Okay, we have nephritis and diarrhea. Nephritis especially with methicillin, okay? And diarrhea is with, like, when we use this extended spectrum penicillin and causes the killing of some bacteria, and we have other bacteria that are going to take the place, like a Clostridium difficile. Okay, and then what? Oh, sorry, I forgot about this. When he spilled all the Vimto on her, she got really angry. And angry, like nervous, and nervous is like neurotoxicity. So we have also neurotoxicity. And why? Because we know that penicillins can penetrate the CNS when inflamed. About cephalosporins, some of the adverse effects are like those of penicillins, like hypersensitivity, nephrotoxicity, and bleeding. Well, talking about bleeding, remember when we've said that penicillins, which are antizoonomonas, causes bleeding? Well, cefoperazone, which is also antizoonomonal, causes bleeding, in addition to moxilectin. Okay, then we know that cephalosporins can be taken intramuscular, so they might cause pain, or they might be taken intravenous, which may cause some problems. Ceftriaxone is exerted in the bile, so it might cause biliary acidosis. You know how some people just hate blood and get ill when they see it? This is our theme for carbapenems. Well, a boy has cut himself by accident and lots of blood came out. So blood is going to remind us with eosinophilia and neutropenia. Okay, so the boy didn't feel well, and that reminds us with nausea, vomiting, and diarrhea. And also, after seeing that, he kind of lost balance, which is something like seizures. So these are the side effects. So the last drugs in the beta-lactams is aspirin, which is monobactam. And to remember the adverse effects, you just remember a bad guy who drinks alcohol. So what comes with alcohol? Abnormal liver function and red rashes. Why red rashes? Because you know how people flush when they drink alcohol? And keep phlebitis in mind. So how are we going to link the name monobactam to these adverse effects? Well, first we are going to remember a lonely guy, and lonely or mono, so monobactam. And then what? So this lonely guy has imagined himself to be an astronaut, and astronaut goes with aspirin. I don't know if you can, And what else? Well, a noisy flight, noisy, pearginosa, I don't know if you can tell. Okay, so this tells that monobactam is active against P. aeruginosa. And the guy started scratching, so this again can remind us with the red rash. The last cell wall inhibitor is vancomycin. Remember that vancomycin is not a beta-lactam. So, when you infuse vancomycin so rapidly, it will result in increased histamine release. And this increased histamine release can cause flushing and shock. And it's what we call red man syndrome. Or we can just remember Spider-Man. Okay? So we're going to have rash and chills in addition to phlebitis. And remember that phlebitis actually happens whenever you have an infusion. And another side effect is nephrotoxicity. Like, look how this spider web looks like a nephron. So this web is going to remind us with nephrotoxicity. And if we give vancomycin to a patient with renal failure, he might develop ototoxicity, which is going to lead him to losing his hearing. Now, let's talk about protein synthesis inhibitors. And let's start with tetracycline. So first, to remember its spectrum, let's draw a circle. So, cycling from circle, and let's say that a car moving around circle in the moonlight. So C for cholera, A for anthrax, C for chlamydia, R for rickettsy, M for mycoplasma, and L for the Lyme disease. And remember how circle looks like acne? Well, tetracycline also works on acne. And now, to remember the adverse effects, let's see the story. Well, a pregnant woman who has acne is driving at night with so her skin does not get irritated. And irritated is going to remind us with phototoxicity. Okay? Now, her youngest son, and his name is Mino, he keeps crying. And this is going to remind us that minocycline causes yellow tears. And why he's crying? Well, he wants to show his mom that he has broke his teeth. And this is going to remind us with hypoplasia of the teeth and stunning of growth, in addition to that tetracycline deposit in the bone causing discoloration. Let's complete. In addition to that, tetracycline causes pseudotumor cerebri, which can be seen in her infants. The adverse effects are gastric discomfort, that's why we better take it with food, and it might deposit in the bone causing discoloration and hypoplasia of the teeth and stunning of growth. It might be fatal hepatotoxicity in pregnant women, it might cause phototoxicity, and it might cause vestibular problems, as we said that his mom is so dizzy, and might cause super infection, and also Fanconi syndrome might occur if we take tetracycline when it's outdated. And finally, minocycline causes yellow tears. So for chloramphenicol, the most obvious adverse effect is grey baby syndrome. And to remember its symptoms, let's just imagine a child who was exposed to chlorine gas, which is bleach, at high doses while his mom was cleaning. So grey baby syndrome occurs in neonates, and it leads to poor feeding and depressed breathing and cyanosis, which can lead to death. That's why we now use isomethylchol instead of chloramphenicol in babies, and we use isomethylchol as an eye drop. And other adverse effects like GI upset, obviously because chloramphenicol might be taken orally, and super infection and anemia. And we have two kinds of anemia, aplastic anemia or hemolytic anemia. Aplastic anemia is due to bone marrow depression, and hemolytic anemia is due to glucose 6 dehydrogenase deficiency. Okay, now let's talk about clindamycin. So first, the therapeutic uses of clindamycin are mentioned in red, and we are going to say them letter by letter. So, wait a second. Okay, so for the letter A, well, A is going to tell us about the anaerobic bacteria and acne bacteria that clindamycin are used again. For the anaerobic bacteria, like bacteria in the oral cavity, bacteria in the pelvis, like lung abscess, and like toxoplasma in the brain. Okay, now let's go to the M letter. For the M letter, it stands for MRSA, which affects the soft tissue. And what's near the soft tissue, it's going to remind us with necrotizing fasciitis, which is usually in the plantar of the foot. And if we went to the C letter, it's going to remind us with the streptococcal toxic shock that clindamycin is used against. Now, if we are going to talk about the adverse effects, which are mentioned in green, and remember when we talked about the use of clindamycin in the oral cavity, where the oral cavity can remind us with other parts of the GI tract, which are other parts of the GI tract that have some adverse effects, like GIT upset, gastrointestinal upset, and Clostridium difficile enterocolitis. And talking about the skin, clindamycin is used to treat some skin infections. Well, when we use this clindamycin, we might get rash, which is in the skin, and we might get fever. We have inhibitors of nucleic acid synthesis. So first we're going to start with quinolones. And to remember the adverse effects of the quinolones, we are going to say the story of the queen. So the queen once went to a soccer match, but the photographers didn't leave her alone. The photographers kept taking pictures of her. So photographers can remind us with the side effects, phototoxicity. Anyways, so these photographs and the flashlight from the cameras made the queen a bit dizzy, and this can remind us with the CNS problems associated with the drug. Anyways, while the players were playing, one of the soccer players hurt his ankle, and this can remind us with the connective tissue problems, especially in children, that might happen while using quinolones. The injury of the player made the queen so afraid. That's why her heartbeat increased, causing and increased heart rate can remind us with arrhythmia. Other side effects are nasal vomiting and diarrhea and nephrotoxicity. And why would we have nephrotoxicity? We will have it because the drug is exerted by urine. So for metronidazole, I couldn't really think of much. So we are going to say the story of a guy named Stephen, and Stephen is going to remind us with the Stevens-Johnson syndrome associated with the drug. So Stephen is an alcoholist, so he went to the doctor, and the doctor gave him metronidazole. So why do doctors give metronidazole for alcoholists? Well, metronidazole, when consumed with alcohol, gonna give some epigastric stress. This is the epigastric area, by the way. And like nasal vomiting and all this stuff, like gonna make the alcoholists feel sick. The sick feeling gonna be associated with alcohol drinking. So when a person sees alcohol again, they gonna remember the all the epigastric nasal vomiting stuff, all the pain. So they are going to hate alcohol. Anyways, let's remember the side effects of the drug using the colors. So green for seizures, fever. In red we have also metallic taste. This is the tongue, by the way. We have the sensitivity rash, the brown shirt for the dark urine. And remember when you say the epigastric stress, well, around the epigastric area we have the pancreas, so pancreatitis, which is inflammation of the pancreas and stuff, and hepatitis, same thing. And we're also going to have peripheral neuropathy. Remember, we have seizures and peripheral neuropathy.